It is my privilege to introduce Dr. Moeti. Dr. Matshidiso Rebecca Moeti is the World Health Organization's Regional Director for Africa and the first woman to occupy this position. She's a medical doctor and public health expert with more than 40 years in national and international experience. Dr. Moeti obtained her Bachelor of Medicine and Bachelor of Surgery degree from the University of London, and she has a Master of Science in Community Health from the London School of Hygiene and Tropical Medicine. Prior to joining World Health Organization, Dr. Moeti worked with Botswana's Ministry of Health in various capacities. She has also worked with UNAIDS as the team leader of the Africa and Middle East desk in Geneva and with UNICEF as the regional health advisor for East and Southern Africa. Dr. Moeti's first term at the Health of Regional Office for Africa started in 2015. In February 2020, she was confirmed by the World Health Organization Executive Board after her resounding re-election for a second term. Over the past 5 years, Dr. Moeti has led a transformation agenda that is widely acknowledged to have improved WHO's performance and effectiveness and to have informed the global WHO transformation. Under Dr. Moeti's leadership, tremendous progress has been made, including interruption of wild polio virus transmission in the WHO African region. This is the second disease to be eradicated from the region after smallpox 40 years ago. Capacities to respond to health emergencies like COVID-19 and Ebola have also improved significantly. Through the regional flagship program of universal health coverage, WHO is supporting countries to ensure people can have access to needed health care without financial hardship. Dr. Moeti has worked with the WHO Regional Office for Africa since 1999, and she has held various senior positions. She successfully led WHO's 3x5 initiative in the African region, which aimed to expand access to antiretroviral therapy in various countries. In recognition of her service to humanity, Dr. Moeti has received many accolades, including an honorary fellowship from London School of Hygiene and Tropical Medicine, an honorary doctorate of science from the University of Health and Allied Sciences in Ghana, honoris causa doctorate by Instituto de Hygiene e Medicina Tropical, Universidade Nova de Lisbon, COVID-19 heroine by Ellen Johnson Sirleaf, President Center for Women, and nominated Woman of 2020 Financial Times. She is a great champion for women in leadership and in global health.
It is my pleasure to share a few words of congratulations to my colleagues at WHO Afro. We have worked together closely in my capacity as chair of the Africa Regional Certification Commission for Polio Eradication, and with dedicated partners, governments, health workers, and communities, including polio survivors, we have achieved tremendous success. We, the ARCC, certified on August 25, 2020, last year, that the wild poliovirus had been kicked out of Africa after a 25-year battle that was first called for by Nelson Mandela, the Yaoundé Declaration. More than 1.8 million people are able to walk today who would otherwise have been paralyzed by the virus, and 180,000 deaths have been averted in Africa. The last strongholds of wild poliovirus in Africa were in communities living in the most precarious circumstances, affected by poverty and conflict. As part of the Afro Transformation Agenda from 2015 onwards, this very special woman that I have a lot of admiration and esteem for, Dr. Matshidiso Moeti, put the polio program under her direct oversight, which reinvigorated Afro's commitment to eradicating polio. AFRO increased the number of polio staff and introduced new approaches and innovations such as geographic information systems to track the reach of interventions and detect cases, even in the most remote and undeserved communities. Now, the polio infrastructure is playing a vital role in responding to COVID-19 and outbreaks of other diseases such as measles, Ebola, cholera, etc. So, I heartily congratulate Dr. Moeti and the WHO AFRO team once again and commend their resolve to realize better health for people in Africa and around the world. I am very proud of you all. Congratulations.
Many congratulations on a well-deserved honor. As Regional Director, you are transforming the WHO AFRO office into an organization fit for purpose for the 21st century and to improve health of all Africans. The still expanding COVID pandemic continues to be a tragedy for many Africans and is exacerbated by the absolutely unacceptable access to COVID vaccines. However, this crisis has also shown the new and unprecedented strength of public health leadership and institutions in Africa. That's a big change. And one hallmark of leadership and of success is to work in genuine partnerships. And that's also something you've been doing. Partnerships with governments, with civil society, with businesses, with other institutions, including with Africa CDC. So in that context, I'm also pleased to see that John Kengasong, the leader of Africa CDC, is being honored and that you're working so well together. Again, congratulations and keep the great work going. Africa needs you.
I'm Mark Suzman, the CEO of the Bill and Melinda Gates Foundation, and I'm incredibly honored to be able to be part of paying tribute to Dr. Tsidi Moeti, the head of the World Health Organization's Afro region, and all of the tireless staff that work across WHO in Africa. They have had one of the most challenging, but also one of the most transformative and impactful years in their history. And Dr. Moeti has been a tireless leader working across issues of gender equity, of the direct response to COVID, of making sure that we do not neglect and forget the many other health challenges and diseases, from malaria to polio to neglected tropical diseases, where we have strong partnerships. And it's been amazing to watch, to see, to partner, to be able to provide help and support, and above all, to be able to see how she, working with the African CDC, working with ministries of health, working with global partners, has been able to lay a platform that is going to allow Africa to finally tackle the COVID crisis fully in the year ahead, and to lay a platform for tackling future global crises going forward. Dr. Moeti, thank you for your friendship and your leadership.
Friends and colleagues of the Africa America Institute, distinguished guests, I'm so thrilled to accept the Global Health Equity Award on behalf of everyone at the World Health Organization in Africa, from our regional team in Brazzaville to more than 2,400 staff in offices across the continent. I thank you. I'd like to appreciate Mr. Kofi Apenteng and the Board of Trustees for this recognition and for your leadership in promoting African excellence and engaging and connecting with the diaspora. I hope that we can build on this by working together to mobilize the bright minds and hearts of African sisters and brothers making a difference around the world to contribute to social and economic progress on the continent. I'd like to congratulate my fellow awardees, His Excellency President Lazarus Chakwera and the people of Malawi, my colleague and friend Dr. John Kengasong and the Africa CDC, and Ablade Glover, whose art captures the energy of life in Ghana. For us at WHO, this award is a testament to the WHO team's round-the-clock assistance to countries to respond to the COVID-19 pandemic, while also ensuring that other hard-fought gains are not reversed. For decades now, we've worked side by side with governments, communities, and other partners to save lives and to prevent the spread of diseases like HIV and malaria. We've invested in the health and well-being of women, adolescents, children, and men, and there is still much more to do. We're supporting countries to attain universal health coverage and to have health systems that are stronger and more resilient. Equity is a driving principle and also a goal which is guiding our actions. As you know, the COVID-19 pandemic has exacerbated inequities that have very long histories. From the Black Lives Matter movement to the livelihoods disrupted among the world's most vulnerable people, COVID-19 is calling out all of us to do more to redress deep-rooted, institutionalized injustices that have a direct impact on health. Together, we must make this pandemic and the focus it brought on equity a turning point towards preparing better for the next crisis. Attention to equity in communities, countries, and internationally brings huge opportunities to make progress for everyone's benefit. Our continent is ripe with the promise of a young and capable population, of innovators building homegrown solutions, and of philanthropists and civil society activists pushing forward together for transformative change. We've worked hard to provide them with some opportunities and to increase investment and attention to African-led research so it can better influence continental and global priorities and action. So in closing, we are eager to engage with you as partners striving for better health for people in Africa and globally. Thank you once again for this award, and I look forward to stronger collaboration together for health equity.